So I qualified in mental health. And how I ended up there was my mum was diagnosed with depression from that. So this is where I think why I wanted to do this podcast with you was that from a leadership perspective, we need to take more responsibility around how we're looking at concerns around mental health in this country. But we live in a society that's very individualistic. And that can mean we can be a little bit negligent of thinking about the other as we're thinking about ourselves. Often, people who are struggling with their mental health need to be seen and heard. So, I guess the question to ask for all of us is our system geared for that? We're in a relationship with our phone. We're not in a relationship with a person who might be living in the same roof, under the same roof as us. And so that's what I'm seeing. I see it all the time. I see it in my personal life as well.
Welcome back to the Education Podcast, your go-to podcast for career and leadership development. Today's guest is Tayyaba Khan, a powerhouse of purpose and someone who truly leads from the front. She's the CEO of Counselling Services Centre in South Auckland, an organisation that has been a pillar of crisis support and mental health care since 1986. But her leadership journey spans far beyond that, with over 15 years of experience across refugee resettlement, human rights, and mental health from the Red Cross in Australia and the UK to the Ministry for Ethnic Communities here in Aotearoa. Tayyaba brings a global perspective to local issues. She's been called a daring leader, and today we're going deep into what that actually looks like, especially when it comes to mental health, community care, and leading with faith and integrity. If you've ever wondered what real leadership looks like in the middle of mental health crisis or how to use your role to support those around you, this episode is for you. So thank you for joining us. How are you doing today?
Thank you
Tayyaba?
for having me, Pasi. I'm good. It's a rainy day, but I'm good. Yeah.
Yeah. It is raining, just so that you guys know. And if you hear a little sprinkling in the background, that's what the rain is. No, these mics are so sensitive, sometimes you can pick up the sound. But regardless, rain or sunshine, we're going to have this very important conversation. So, Tayyaba, take us to the beginning and tell us, start wherever you want, and how you ended up in mental health and your passion for it.
Yeah. So just a little bit about me, Pasi. So I grew up in Auckland. I'm through and through Aucklander. I am twice dropout from law school, actually. I thought I would always study law and become a lawyer, particularly a human rights lawyer, but life just took me on a whole different trajectory. So I qualified in mental health. And how I ended up there was my mum was diagnosed with depression, which, so I'm, by birth, I'm Pakistani, though I grew up in Japan and New Zealand. It was, I guess it's not blunt enough to say this, but it was a shock to the family, right? Because depression, as a word, is not a common term that we find in our culture or even our religion, to be honest. So I'm of Muslim background.
And how old were you when mum was diagnosed?
So I was in my 20s, yeah, when mum was diagnosed. I was already studying, and I dropped out of school. I was at Victoria University doing my first semester in law school when we got the news that mum was diagnosed with depression. And my dad, bless his cotton socks, was a little bit, what do I do? What does this mean? How do we support, how does he support his wife, but also how do we really lean in as a family to make sure that she is well and taken care of? So I came back to Auckland. And I didn't study for 6 months, so my educational trajectory has been all over the place. I'm one of those people who have tried very hard to kind of study in your traditional role models and systems that exist, but it just doesn't work for me because I come from a collectivist culture and I'm always responding to some other responsibility that exists in life, right? And so this was one of them. So I ended up taking care of mum predominantly for 6 months, and just kind of learning about depression and what that meant and what it means for us culturally, spiritually, to be able to support her. And funnily enough, I think this is just serendipity. At the time, AUT was rolling out a degree in Bachelor of Health Sciences with a major in applied mental health. It was the first time that they were rolling out this degree. And the flyer actually ended up in our mailbox. So I saw that as a sign and I, enrolled and off I went. So yeah, that's my story. That's how I ended up in the space of taking care of people. Like, it's a really important part of who I am. Yeah.
That's beautiful. Thank you for sharing that story. I can see why it means so much and why it hits so close to home. Obviously, because of home, right?
Yeah.
And especially for it happened to someone that you love and look up to, especially mum. How did you feel when you heard the news?
Yeah, I think I was confused, right? I think a lot of cultures shy away from anything to do with mental health, and we're definitely one of those cultures. It's seen negatively, it's a taboo subject, we don't talk about it. So when it came up, it was like, well, what does that even mean? I don't think I've even heard the word before, really. And when you're far away, like I was in Wellington when I heard. It can be shocking to the system. You care about someone who's obviously struggling, and you think, what do I do? How do I react and respond? And look, it wasn't hard for me. I dropped out of school and I came back to Auckland. So, yeah, that was my reaction.
Yeah. And that you said you looked after mum for about 6 months.
Mm.
Like, what did you learn about mental health and what your mum needed during that period?
Yeah. I think what I learnt most is that for migrant families here in New Zealand, isolation can be really difficult, and we really um, don't recognize that enough. New Zealand can be a very lonely place, especially if you're coming from collectivist cultures where your family is everywhere, you've got support systems, you've got aunts, uncles, nannies in your lives, and you're never really alone. And my parents were very much alone here. They raised us by themselves. They didn't have any support networks. They were building a community here, but everyone else is building their community here too. So um, I think it eventually just got to my mum. It impacted her physical and mental health. And so what I learnt was that first and foremost, she just needed a lot of support, care, affection, just gentle encouragement to do, just day to day life, which is really a lot of my time during those 6 months, conversations, cups of tea, walks, really basic things. I think we think it's quite complicated, but it really isn't sometimes. Obviously, getting her the right medical care was very important. And she's still with that GP today. Like, there's this loyalty and bond to there in terms of the GP that she sees. She still goes to that GP, and yeah, I think we were very lucky that the healthcare system was good to her, and she was able to get the support medically that she needed straight away to be able to address what was going on for her. She's doing really well now. And so, yeah, in the 6 months, I think I just learned that life needs to slow its pace down. And when you're taking care of someone, you just need to work at their pace, um, and really have your finger on the pulse to know what they might need rather than impose what they might need.
And now, obviously, this is just one case of many, and you've seen many, especially
Mm.
being in this space, CEO, of an organization that does counselling services. You've probably come across many mental health cases like this. What have you learned has been some of the biggest reasons or contributing factors as to, struggles with mental health?
Yeah, look, I think it would be remiss not to acknowledge what's happening environmentally and how it's impacting people's mental health, right? I think it's very easy to just fully focus on a biomedical model and not recognize that there would be other things, other holistic things that could be impacting people's mental health. Today's Auckland is struggling with homelessness at a significant rate. People are struggling to put food on their table. There's less and less time for family. Those are just some of the societal issues that are impacting people's mental health. I think we immediately go to, oh, this is something about a chemical imbalance in the brain. And look, it often is. Um, but there's also other things that contribute to how we can make lives better for people who are struggling with their mental health. So I think that's what I've learned. I've learned that we can't ignore what's happening in the environment to take care of people, because that can exacerbate the mental health issues that they might have. So that's really important for me now. And at the Counselling Services Centre, we're really talking about how it's important to look at the community we're in and what does the community need. I mean, it's easy for someone to come and, have a couple of sessions with a counsellor and go away, but that's probably not going to solve the root causes of the problem that are, occurring for people in their day-to-day lives. So what's our role in that and how can we contribute to that? And that's, I think, becoming a really important part of the conversation in taking care of people and their mental health.
So you mentioned, obviously, I agree with that. There's things outside of our control that do impact us, and the macro,
Yeah.
political environment, could be something related to work, being made redundant, not being able to provide for my family. I don't feel like I'm living up to my worth or my responsibility as a provider. There's all sorts of domino effects,
Yeah.
that start outside your control,
Yeah.
but ultimately impact you. And like you said, like still at the end of the day, like you can't solve those things as counseling services. But what can you do?
Yeah.
What can you do to support them if you can't control all that stuff? If you can't change policies, if you can't, get that job that will pay you well,
Yeah.
how can I support my mental health?
Yeah. And I think that's such a it sounds like such a big problem to solve, right? It sounds like one of those wicked problems to solve. But look, for me, I think simplicity is so important in terms of what we could do, and we need to focus on that. So this is where I think why I wanted to do this podcast with you was that from a leadership perspective, we need to take more responsibility around how we're looking at concerns around mental health in this country, not just in our part of South Auckland. We've got some systemic issues that are exacerbating people's mental wellness. So one of the things that we talk about at CSC is, for example, when someone doesn't turn up to their appointment, it's not that they don't want to. What was the root cause? What was happening? What were the barriers that they didn't get to their appointment? And often you find transport is one of them. The inability to afford transport is another one of them. So I think from a leadership perspective, we need to think about how we've built our society and how we can make it easier for the people that we all want to serve and care for. We're doing it from different angles and perspectives, but are we really thinking about the person at the end of the day as we do our work and as we design the society that we live in? And I think that for me is becoming really important in my leadership journey, So as the CEO of CSC, I meet with people who might not fit in the remit of my work at all. And I want to talk to them about, well, what are you doing to improve public transport in Auckland so that someone who needs to get to their GP appointment or someone who needs to get to their counselling appointment can actually do that? Those are the ways that I think we need to look at how we solve these issues, the systemic things that are getting in the way for someone to access basic care. Yeah, and that's where I'm at the moment.
Yeah, definitely makes sense. And you believe that, mental health is everybody's responsibility. Can you talk a little bit more about that? What do you mean by that?
I absolutely believe that. I think that's becoming so important. Well, I come from a collectivist culture, and for us, it's not just you. It's not just about you. Even in your leadership journey, you're thinking about many, many others. And so, but we live in a society that's very individualistic. And that can mean we can be a little bit negligent of thinking about the other as we're thinking about ourselves. And I think we need leaders who are thinking about everyone else differently, and in a way that offers care, kindness, and compassion. I do think those values are kind of becoming secondary because we're so busy and we're trying to be really reactive to a very fast-paced society. And as we do that, when we inevitably become negligent of the people who need care. So, yeah, I do think in a country where we're having a mental health crisis, we've got a health system that needs a lot more tender love and care. It's a system that's, and look, there are leaders who are working really hard to solve those systemic issues and make us, a world-class healthcare system. But we're not there yet. And so I do think there's something about our responsibility. There's something about our perspective. There's something about how we need to think outside the box for the people who we think we want to reach. And that is everyone's responsibility.
Because when you mean by that is when you say everyone's responsibility, it's not just like mental health is my responsibility,
Mm,
but you're saying it's my responsibility to look after the person to the left of me and to the
absolutely.
right of me. Kind of like what you did with your mum,
Yeah.
right?
Yeah. Yeah, kind of like what I did with my mum, but it's also something I will do with anyone who I feel is in community with me, like my neighbors, for example. And, it's a rare thing to think about these days that
Yeah.
you know your neighbors and that you have a good relationship with them, but we know our neighbors. And so, um, knowing that if something difficult is happening, being able to be there for them is inevitably good for their mental health, as it is for ours. So,
Can we talk about that for a bit? I like that because let's be honest, some people are probably not good at reading it.
mm,
How do you know if someone is maybe on the brink of it
yeah.
or maybe going through it? What are the signs? What are the cues? I know it's hard to kind of pinpoint one thing, but is there any way that we can get some sort of indication whether someone needs help?
Yeah, look, everyone's different. There's no sort of prototype of knowing straight away, right? But this is where you need to know whether you're in a relationship with someone and whether you're actually as observant as you think you are. If I was genuinely, authentically in a relationship with someone, and that could be colleagues, that could be neighbors, that could be strangers, there are things that you observe that you know something is not quite okay, right? And it's those signs that allow you to open up a conversation. It starts with a conversation. Hey, are you okay? And genuinely meaning that, stopping to hear their response. Um, we're really good at just kind of casually asking, hey, how are you? But we don't really mean it. We don't really want to know, hey, how are you? And I think we need to become people who stop and really want to know, hey, how are you? And is there anything I can do? Now, of course, that could be a capacity issue for you, and you might not even have the time or the resources to be able to help someone out. So measure that appropriately. But I do think that if you are genuinely paying attention, you will see if someone is, not quite the same to what they were 2, 3 weeks ago. Of course, your very major signs can become things like hygiene and clothing, and
Mm.
they're not quite um, organized, and everything is very disheveled and chaotic. But those are your very kind of obvious extreme signs. But there's always subtle signs. So for me, I think if we became people who were just kind of paying attention a little bit more, stopping, really genuinely inquiring because we care, you'll find out.
Yeah, like
Mm.
that. I think it comes back to what you said. Like the more you know them, the more you will just know when something's off,
Yeah,
right?
yeah.
I don't want this to sound wrong, but instead of being the ambulance at the end of the cliff,
Mm.
so just reactive, like like look, there's a need for it. It happens. We need the ambulance at the end of the cliff
Hmm.
because that's just the reality. We got to support people who are going through it. But what are some? I wouldn't say preventative, but what are some ways that we can keep our mental health healthy? If that
Mm.
makes sense.
Yeah. Yeah, and it's interesting you say that we need the ambulance at the end of the cliff. We absolutely do, but even the ambulance guys are feeling the burden of it, right? Because it's only kind of getting really intense, and that the wait lists and the number of people that need to be cared for is increasing. So preventative stuff, I think that's becoming really important, is addressing things like food, is addressing things like economic scarcity, is addressing things like who needs to be prioritized in care. Primary care, not necessarily your emergency care. Um, Access to primary care is becoming harder and harder. GPs see you for 15 minutes a day, and you don't necessarily feel like you've been seen or heard. We're talking about a system that's becoming very um, disconnected with the person, that requires you to look at their widower and see them. Often, people who are struggling with their mental health need to be seen and heard. So, I guess the question to ask for all of us is our system geared for that? Even at the preventative end of the spectrum, are we operating and engaging in a way that allows for that person to be seen and heard, so that before it gets to the ambulance part, we've actually tackled things early on? So once again, going back to the work we do at CSC, which is preventative work, we're thinking about how do we actually make sure that we're able to help people come up with skills and tools and strategies before they end up in, mental health unit or before it becomes an emergency situation. How do we make sure that when someone is sitting in a room with us, we're able to work with them early on and actually make them seen and heard through therapeutic modalities and actually support them in building their resilience so that it doesn't get to, them needing an ambulance. And it's a change in the way that we all work, but it's a welcome change because we need it.
That's interesting. People need to feel seen and heard. And basically what you're saying is if people don't get enough of that, it could lead to mental health struggles.
Absolutely.
Like,
absolutely.
Yeah, can you give us an example of that and maybe like bring one close to home?
Yeah, I mean, I think my mum is a good example of that, right? Like she was raising 5 kids and she was just getting on with life and she was neglecting herself to its extremities. She was no longer just her. It was all about us as children. And I would say she was screaming to be seen and heard. Like, where was her time? Where was her care? Where was her, time to unwind? And a lot of mothers are like that. So yeah, I think that for me is a classic example in my personal
And
life.
that's a perfect example, and I think it's actually quite common. And like you said, there's a lot of moving parts that it can make it really complex
Yeah.
and ultimately affect people's mental health. Like, hey, family's got to work. Mom and dad got to work. And sometimes, they have to in order to provide for the family. And then sometimes they don't get enough time for themselves. Or,
Yeah.
or then it's like the time they do have left, it's to the kids. It's this and that running around. What's your advice? What can people do? Like,
Yeah.
even in their day to day, that's practical, that could still make them feel seen and heard and still kind of like look after themselves. Anything at all?
Look, this is going to be controversial to say, but I think having an hour of no phone time in your home, if you can manage that, great
Oh
stuff.
my goodness, if you can't manage that, there's something wrong.
Yeah.
Oh my goodness, how's that controversial? But anyway,
Yeah.
carry on.
Yeah. Like, I think that's a simple, maybe small way to start. Like, an hour in your day without phone, with all of the family members as you sort of gather, time to just have a meal together. I know this might sound like it's so obvious, but families making time to just sit together and have a meal together and have a conversation together and hear about what each other's day was like and what was the struggle, what was great, all of that, talking to each other, seeing and validating each other, and co-regulating each other in that time.
Wow, that's powerful. You just reminded me of a podcast interview I had with Dr. Alexander Stevens, who has done a lot of his research around mental health, sexual abuse, drug and addiction, especially for Pacifica and Māori. He shared on the podcast that preventing suicide is as easy as sharing a meal together as a family. It's like, what?
Yeah,
It's like preventing suicide is as easy as sharing a meal around a dinner table
that is
as
powerful.
a family. And it does come back to what you're saying. It's that being seen, being heard, being together. There's just something about that.
Yeah.
And do you feel like the way that the world's going now with technology, and it's crazy that you're a bit hesitant about saying this might be controversial. Like
I say this because young people will be
10
up in
years ago,
roars.
10 years ago, people will be crazy if you spent
Yeah.
an hour on your phone because that's too long.
Yeah.
It's like, what are you doing? But now it's flipped.
Yeah.
Like where are you like in your space, in your industry, because you've been here for a long time? What are you seeing as a trend, especially here in New Zealand with mental health?
Yeah. Well, I mean, I think people are really disconnected to each other, right? We're in a relationship with our phone. We're not in a relationship with a person who might be living in the same roof, under the same roof as us. And so that's what I'm seeing. I see it all the time. I see it in my personal life as well, where we're constantly encouraging my nieces and nephews to get off the phone. It is really having a significant impact on people's mental well-being. You're constantly gauging yourself and comparing yourself through the eyes of someone you're seeing on a screen or what you're hearing. And the ability to be able to have critical analysis, decipher what is, good information and bad information, it's going out the window because where are we teaching people these skills? We're not. So technology has really kind of rapidly, I suppose, sped up this whole notion of information, which means that people have not upskilled themselves in terms of knowing what is good information, what is bad information, and how is my relationship with technology important in terms of how I live my life today. So I think, yeah, look, I think that if we could just do those basic things. I went to a Outward Bound course recently and it changed my life. Prior to it, I had very little to no relationship with the environment. I wasn't doing things like running or any physical activity purely because I live a very busy lifestyle. But having 5 days of just, being in the outdoors, not having a phone, and I think I have a really good relationship with my phone. I don't use it all the time. I came off social media for a while. But it just changed my perspective and it allowed me to see, wow, there's so much that is going into our mind. We're consuming so much, and our ability to process it is only so limited, right?
Yeah.
So imagine what it's doing to our brain. And why are we doing that to ourselves? So yeah, I think we need to get back to the basics. Let's think about our relationship with technology. Let's think about the things we always knew were important: yoga, walking, running, going to the beach and maybe just taking a dip in the water. Um, there are some indigenous practices that are beautiful. Why are we not making that a part of our day to day life? That would bring us back to our good mental health, I think, space. And those are becoming really, really important.
I think you are right. I saw a video on social media the other day. It was a father who had caught his son, but giving him a pretty stern talking because his son had watched a YouTube video and the video told him if you're feeling bad or something like that, like take your own life.
Oh,
And that boy was gonna, he would have been like nine,
yeah.
8 years old,
Yeah.
saw some content online
Mm,
and thought that's what I'm gonna do.
mm,
And there's been many cases like that.
yeah.
Um, kids just taking their lives and stuff based on
Mm,
what they consume on
yeah.
social media. And you're right, like it's like, man, how do we teach our kids like critical thinking? How to
Mm,
discern what's right, what's wrong?
yeah.
Like I just feel like it's becoming more and more of a lost art. I wonder what your thoughts are around artificial intelligence. Hey, look, it's a big topic.
It
I don't know.
is,
I just wonder if
yeah.
there's if, anything that you've been thinking about, any
Yeah.
thoughts or things that you've seen or heard, even
Yeah.
like do you feel like things like AI is there a correlation now? Is it making things better
Mm.
or worse for mental health?
Well, I think I would ask myself, is technology making things better? And then I would focus on AI. And I don't know if technology is actually making things better, to some extent, sure. But if we're not educating people around how to use it well from a wellness perspective, then it's actually not helping. So AI is similar, right? You need to look at the positives of it, but it needs to come with some level of regulation, and so that it just doesn't go wild and impact people's lives. I was reading a post on LinkedIn yesterday, actually, by a woman in the US who was talking about how there's always pros and cons to technology. So even with AI, what's your purpose with it? And where are the boundaries with AI? And everyone's going to have their own, but you need to start with that. Don't just jump into it and go, yep, okay, AI is here and I just need to kind of go with the flow. So that's where I'm at. I think I'm still assessing what does that mean on the impact of people's health. How will it contribute positively? And where we already have a problem with social media, where it's not helping people's well-being because we didn't regulate things in time, and now we're sort of backtracking and trying to bring in regulations and trying to encourage people to think about a positive way of being with social media. It will be the same with AI if it's just rolled out en masse and there's no control around it. I think some level of control is important for all of us, just like structure is important for us in our day-to-day lives. So yeah, that's my thoughts.
Yeah, I like it. I mean, it really does come back to that. It's what's your purpose.
Mm.
Technology is just a tool.
Yeah,
It's not a substitute for human connection. It's a tool to enhance
yeah,
human connection. And like you said, for me, when you explain it like that, it sounds pretty simple.
mm.
It's like,
Yeah,
how long are you spending with technology versus how long are you spending with people?
yeah,
Like you just said, and you told us that mental health is strengthened, and we're much more better when we're seen and when we're heard.
yeah.
Like that comes from being with other people.
Mm.
Being
Absolutely.
seen and heard, it's like technology can't give you that.
Yeah.
So it's like, I think that's a nice way to measure it, as like, how much time am I spending on technology versus how much time am I spending with people, the ones that I love.
Mm. Yeah. Are you getting the care that you need that's going to help you to improve and strengthen and build resilience, and does technology do that? If it does, look great, but if it's not doing that for you, you need to find your connection with other things. Nature can do that for you, absolutely. But how many people do we know who are just kind of running towards nature as a result of wanting to improve their mental health? I think we could be doing a lot better in that space as well, and which is why I think Outward Bound is a great course for people to do, because it really does help you reconnect to nature.
There's nothing like, even if it's not nature, it's just getting out of the house.
Yeah,
Like the other day, I was just thinking about it. I was like, man, I really enjoy this. Me and my wife, sometimes, you have those weekends where it's just like you want to chill.
yeah,
You just want to watch a movie. You want to,
yeah,
just as long as you're around each other,
yeah.
then it's all good. But I think there's nothing can beat like going out to Mission Bay, having ice cream with the kids, going for a walk, spending family time,
Yeah,
even just the drive in the car to get there. Like nothing can beat that.
absolutely. Yeah,
Like
absolutely.
even if the kids are in the back seat, like, mom, dad, it's like, I love that.
Correct.
Like those are the memories I want,
Yeah.
not the ones where I'm just like, watching TV, watching movie.
And I can guarantee those are the memories they will remember as they grow up, right? Those are the things that are
Of
going to
course.
matter for them. And so we've got to remember that. We've got to remember what imprint we're leaving on people's memories through our connections. And it is the simple moments. I know, like, often people think I might have to say something very complex, but actually, it's all quite simple at the end of the day.
Yeah.
Yeah.
If we're talking to our leaders who are responsible for a team at work,
Mm,
yes, look, I had this conversation with my previous guest. You've got to find a balance between caring for your people
mm,
and also performing, like results. Right?
yeah.
We need to get results to put food on the table,
Yeah.
pay salaries, etc. So, how does a leader not just make time, but make mental health a priority,
Mm,
especially amongst the busy to do things that they have to execute?
yeah. Leadership is becoming hard, right? I think because the culture of leadership is changing so rapidly. And so we're also learning as society around us is evolving. But look, I think balance is always such an important thing, right? So I read a lot of Brene Brown's work in this space, and I find her really empowering. And I think it's really important that leaders remember where there is the care for their people, there is equally the care for yourself. And striking that balance is becoming more important than it has ever been before, because the culture of workplaces is changing rapidly. People are expecting our workplaces to be healthier. They're expecting that they can turn up in their full selves and that you can manage that. And for you to manage that, you need to be skilled to do that. So I think there's a lot of complexities happening for leaders in this space, in the leadership space. But the thing to remember is that as much as it is about the others around you that you're caring for,
Mm.
you have to care for yourself, because otherwise we go back to that scenario of mothers, right, who are constantly giving, constantly caring for their children to the point that they're neglecting themselves. And then it becomes a really unhealthy situation. It's the same for leaders. You have to take care of yourself. And you have to do it in a way that works for you. We are living really busy lives. And I know I live a really busy life, and I'm constantly having to remind myself in my day, there has to be a moment where there's complete pause. Like I have to push myself to just stop, to breathe, to actually recalibrate, to just appreciate what's happening around me. And look, that might just be 5 minutes, but it has to happen. Otherwise, the likelihood of me making poor decisions, you know, just being agitated with people around me, they will see this stuff, is very high. So, learning to find that balance for you and for others is becoming really important.
Yeah, because you're a CEO, you're a leader yourself. You're responsible for a team.
Yeah.
So, can you give us an example of what you do?
Yeah. Yeah. Oh, letting it all out now. Yeah, well, look, I'm a reader. So I love to read. And I will be the first to admit that for a long time there, I just let go of all sorts of personal practices to just get on with work. And I've had to really kind of come back because my own mental health took a real toll in the last couple of years. There's a whole raft of personal things going on, and it was a lot. And it helped me learn that actually, yeah, the universe was giving me a sign that it was time that I started to focus on me again. So for me, reading is a really great tool. And I'm not talking about reading on my phone or reading on a screen. I'm talking about books. I love the idea of touching paper, smelling books, having that moment, having a cup of coffee, tea, whatever is your buzz, and making time for that. That's become really important. And since Outward Bound, of course, I've started to do a lot of walking and running, which is great. I didn't think I would like it, but I love it. It's the thing that I now do so that I can find time outside of everything else just to be with me. And last but not least, I haven't gotten there yet, but I'm hoping to very, very soon, hot yoga.
Nice. We've got hot yoga right next door.
I know. I could just
It's a
pop
sign.
in.
There
Yeah,
you go.
yeah. But I guess for me, ancestrally, it's a practice that comes from where I hail from, right? So it appeals, and I would love to kind of reconnect with it in a positive way. Yeah.
So, I want to ask a few more questions before we wrap this up. This is really good, by the way. Thank you so much. If we look back, both you and I have been around for a while now. We've seen enough
But
change.
we're young though, right? We're still young. Yeah.
Well, young compared to
Yeah.
Anyway, age is nothing but a number. But what are there traditional methods or things that we used to do in the past that were good for human connection, good for mental health, that people have just dropped the ball on?
Yeah.
I mean, we've mentioned talking about spending time together versus technology. Is there anything else in particular that we're missing that we used to do?
I think one of the things that I'm seeing a lot more of is social engagements just for the purpose of caring for others. The visiting of your family members, the visiting of your uncles and aunts and people you're socializing with. That idea of visiting people for no reason whatsoever actually is really important. And so I think that would be what I'd say is kind of missing now and probably needs to be brought back.
So you're talking about wonder what mum and dad's up to. I want to go pop over and have a look.
Yeah.
Rather than be like, what's my purpose?
Yeah.
Why do I need to go there?
Or that
Whose
I need
birthday
to.
is it?
Yeah. Exactly. Yeah, what's the occasion, and does the occasion warrant for us to kind of pop in and see someone and just check in on them, drop muffins or whatever it is that you used to do in the olden days. I sound like I'm really old, but yeah, that whole idea of cultures that would just kind of check in on each other. And we're really losing that. Where it's like, oh, I have to schedule maybe a dinner with you 4 weeks down the track somewhere else in a restaurant. We'll kind of get together for an hour and a half and then we'll go away, but actually so detached from what's happening in a person's life, and you care about that person. You're actually friends with them, or you're a family member, and that's the way that you actually engage with them now. I think that we need to go back to what we used to do, which is, do I check in on you without it having any big kind of, I don't know, significance in terms of what's happening in your life or mine? Do I just know that you're okay? And how do I do that? And how do I bring that back?
Yeah. I love that. It just reminded me, even just this week, I was just driving to see a client out in the city, and I had a lot of time to kill. Could listen to a podcast, but for some reason, I just thought I'm gonna pick up the phone, just call
Oh,
my friends, and just see how they're
nice.
doing.
Yeah.
But sometimes when you call people, they're like, "Oh, hey, you all right? You
Yeah.
all right? You need anything?
Yeah.
Or how can I help you? What's up? What's up?" It's like, no, just call in just to see how you are.
Yeah.
How's things going?
Yeah.
I haven't been asked that question in a long time. Well, things are good.
Yeah.
And I do that, and honestly, by the end of it, we're just like, man, I actually needed that. That was good.
Yeah.
Sometimes it's just good. Honestly, and there's a group of us boys,
Mm.
and some of us play game like Fortnite because
Nice.
it's more than just entertainment. It's about catching up online because you talk to, hey, what's up?
Yeah.
But there's us group of boys. We once a year we plan a boys trip,
Oh, cool.
and most of us are dads.
Nice.
We've
Yeah.
got responsibilities. We've got kids. What the heck are these dads doing? It's like, hey man, go back to your family. And so when we first started this 2 years ago, the idea and the concept of it was a bit awkward, weird, like
Mm.
taking time for ourselves.
Mm.
It's like we've got
Yeah.
better things to do right now. I've got a responsibility. But I'm grateful my wife encouraged me to do it because she was doing it with her
Great.
friends.
Great.
We were just talking, we're like, hey, maybe you should do this with your boys. I was like, okay.
Yeah.
Did all my friends' wives agree with it or support the idea? Not all of them were all on board, but hey,
Yeah.
I mean, again, it's not normal,
Yeah.
right? But by the end of it, all the wives were like, man, I'm so happy you went.
Yeah.
Especially when we came back, changed, lifted, and some of the good stuff that came out of it was not just spending time, but some of those boys, because we went to the gym together, now they're in the habit of going to the gym,
Great. Yeah.
you know?
Yeah.
But I just feel like it's weird for men to hang out like
Mm.
that
Mm.
these days,
Yeah.
and we need to change that.
Well, why is it weird though? Why is it weird? And also, you said something really important there. As you said, well, you talked about, well, I've got better things to do. But isn't your care better as well? Isn't
Well,
it important as well?
yeah. That's a really great question, and I've had to ask myself that, like, why is it
Mm.
awkward? Um, I think because I believe we're being conditioned. We're being
Mm.
conditioned to believe like just go to work, your family, especially as men,
Mm.
and don't cry. Stop being weak.
Mm.
The people need you to be strong, need you to lead.
Yeah.
And I believe that too.
Mm.
But in order to be strong and to lead, you need to kind of step back and sharpen the saw,
Oh, yeah.
sharpen the axe,
Yeah.
right? You got to take time. That's why I go to the gym often.
Great.
I go to the gym. I try my best to eat healthy.
Great.
But I always invest in taking care of my health. Because if I'm sick, if I'm lazy, if I'm tired, like how can I show up and serve my family and serve my team? So it took me a while to think like that
Mm. Mm.
rather than the opposite.
Yeah.
And it's crazy because when I used to go to the gym and I used to go daily, other people would say, Pussy, you spend too much time at the gym.
Mm.
You got better things to do. Why do you need to look good? What is it? It's like, bro, it's not about that.
Yeah.
It's about looking after your health so you can live
Yeah.
long and have the energy to run around with your kids.
Yeah.
Look after your family.
Yeah.
Right?
You're giving them a gift, right? By looking after yourself, actually. Because in reverse, you're right. If you became unwell and they had to take care of you because you weren't doing the bare minimum to take care of yourself, then actually that's really not okay, yeah? So I think, I mean, you're a great role model, Pasi, because like I read your blogs and I think you talk a lot about family, you talk a lot about spending time with them. And I think men really need to read and hear that more, that actually it isn't just about the treadmill of like earning money. It's going to make you an unhappy person as well. It's about so much more than that. And finding that balance is so important. So I think role models like you talking about this as an important part of mental health for men is becoming critical. Yeah, because by and large, men die younger than women statistically. And what does that say about how much they take care of their health?
Mm.
Well, yeah, not so much.
Yeah, no, I appreciate that. Thank you for your kind words. And, you know, yeah, I've been thinking about this a lot. It's a very, very tough and tricky topic,
Mm,
you know, mental health. But you're right, we need more role models
mm,
out there. We need more
yeah,
people talking about it.
yeah.
And, but look, this conversation has definitely been valuable and insightful, and I appreciate you sharing your experiences, especially with mum and also with yourself. You know, but those stories are definitely going to be wisdom for other people. You know, if there's anything about mental health, especially for leaders, that you want to leave with our audience, any advice around that, what would that be?
Yeah, I think it's like I'd said earlier, I think it's time we start looking at the system that we work in and work towards to change. And that's becoming the responsibility of leaders so that it actually works for people's mental health rather than becomes a barrier for people's mental wellness, you know? And if we can come together and solve that problem collaboratively, that would be amazing. That's what I would leave as my final message for the leaders.
Beautiful, love it. Nice way to end the podcast. And if people want to get in touch with you, or if they want you to be able to speak or any of your services, how can they do that?
Yeah, so look, we'd love for you to get to know more about CSC. So we've got a website, but you can also just Google us, Counselling Services Centre, www.csc.org.nz. Yeah, reach out. We'd love to hear from you if we can help. We're here. We're here to help people in the county's Manukau district. We specialise in working with family harm, sexual violence, general counselling, grief, trauma. We're a trauma-informed care practice. So, yeah, we're there for you.
Awesome. And thank you again so much for your time and being generous with your insights. There we go. CEO Tayyaba of Counselling Services Centre.
Yep.
Awesome. Thank you for your time.
Thank you.
And that's a wrap for today's episode. If this conversation gave you something valuable, do me a favor, share it with someone who needs to hear it. And if you haven't already, hit the follow or subscribe so you never miss an episode. This show is all about helping you unleash your greatness, and the more we grow, the more we can bring you content that truly makes an impact. Thanks for being part of the Education Podcast. Let's keep pushing forward, and I'll see you next time.